Dr. Shanique HIBBERT is a part of the medical team at the Thomas Medical Center, where she administers patient-centered practice. She's a passionate caregiver who makes the well-being of her patients a priority. Dr. HIBBERT is a graduate of the MBBS program at the University of the West Indies, Mona campus. Prior to medicine, she completed an MSc in occupational and environmental health and safety and a BSc in experimental biology at the said UWI Mona campus. When Dr. HIBBERT is not working, she makes time for serving in the music department at her church, maintaining her health in fitness classes, and attending to her beautiful home with her husband. It's a pleasure to have you, Dr. HIBBERT, and I'll hand over to you right away.
Thank you so much for having me. Hold on, I'm going to share my screen. Everyone, I'm Dr. Shanique HIBBERT, and today I will be talking about probiotics. Listen to your gut. All right, so firstly, we're gonna go through brief history. We're gonna discuss what probiotics are, how do they work, why they are important, the effects of probiotics on illnesses and diseases. We're gonna characterize them and identify them. Then we're gonna go through some of the disadvantages, and then we're gonna wrap it all up in our conclusion. Okay, firstly, a brief history of probiotics. So Russian Nobel Prize winner, which we consider the father of modern immunology, Eli Mechnikov, he was the first person to conceptualize probiotics. And that was in the 20th century. In 1907, he proposed that the acid-producing bacteria in fermented milk products, if consumed regularly, led to a longer, healthier life. And he did this based on observation of some villagers in rural Bulgaria. He noticed that they were doing this. They were consuming the fermented milk products, and they were living much longer, healthier lives. Then in the 1930s, the Japanese microbiologist Minoru Shirota developed a fermented milk product called Yakult. And then in 1965, Lillian Stilwell officially coined the term probiotic. And they defined it as substances produced by one microorganism. Can you hear me?
My apologies for that, Dr. Dr. HIBBERT, just before you continue. Rita, I tried to be patient, guys, but I'm going to ask you, like, I tried to make it very easy for you. Just before you continue, Dr. Go ahead, Dr. HIBBERT.
Okay, all right. So yes, I was saying that Lillian Stilwell officially coined the term probiotic as substances produced by one microorganism that stimulate the growth of another. And so what really are probiotics? In 2014, the WHO defined probiotics as live microorganisms that when administered in adequate amounts, they confer a beneficial health effect on the host. And that pretty much means that they are what we call the good bacteria or the good germs, as Dr. Thomas was saying. The word itself, probiotic, is of Greek origin. Pro means before or forward, and biota means life. And so probiotics are life promoting. They are the beneficial bacteria. As I said, they're the good bacteria or the good germs. And that's what we'll call them from here on, the good germs. So exactly how do probiotics work? How do our good germs work? So they have a number of functions, and Dr. Thomas has touched on them, but we'll go through them again in some amount of detail. And we are going to start at 12 o'clock. So firstly, we have 8 of them. So firstly, they prevent pathogenic microbes. So all your bad germs, your bad bacteria, your viruses, your worms, your E. coli, your rotaviruses, your flus, your Giardia, which are the worms. It prevents those from going into the blood cell or into the bloodstream, sorry. And it does that in a number of ways. And as we go around the circle, we'll touch on those ways. Number 2, it adheres with the gut epithelium. And that pretty much means that it just sticks to the gut epithelium or the gut lining. And so basically what that does is that it crowds out the bad bacteria. So it leaves no space for the bad bacteria or the bad germs. Number 3, it produces useful substances. Dr. Thomas also touched on this. The vitamins, some of the vitamins that we need are produced by our good germs or our good bacteria. The vitamin K, vitamin B12, it produces some organic acids which are necessary for antibacterial properties, again, preventing our bad bacteria from coming in. And it also produces some neurochemicals. So for example, serotonin, it interacts, as I said, as Dr. Thomas said, with the brain. And so neurochemicals like serotonin are produced. And what that does is that serotonin is your feel-good hormone. And that will reduce your risk of getting mental disorders like anxiety and depression. Other mechanisms, we're at number 4, other mechanisms, for example, what we call bioconversion, and producing fancy things called short chain fatty acids, which are very, very necessary to reduce inflammation. And inflammation, as we just learned, is responsible for a whole host of things in the body. Number 5, it strengthens the host immune system. So it communicates, the probiotics or the good germs, they communicate with our immune cells. And so it regulates the immune system, the immune response that we'll have to good germs. Number 6, it also colonizes on the gut lining. So colonization resistance. And that pretty much means that it crowds out the bad bacteria. So the bad bacteria or the bad germs has to compete for space and nutrients. But when you have the good germs in abundance, the bad bacteria will not be able to thrive as a result of them not having space, them not having the nutrients that they need to survive. It is also probiotics. They also function by being resistant to host gastrointestinal conditions. So that pretty much means that they are coated with food-like substances, and that prevents their breakdown, and thus they can colonize, they can be viable, they can line the gut epithelium. And lastly, it improves the barrier function, as Dr. Thomas was talking about earlier too. So with all of that, that can be summarized by probiotics doing 4 things or operating in 4 ways. So it interferes with the pathogens or the bad germs, and it does that through short chain fatty acid production, by sticking to the lining, by making or producing things that will kill the bad germs, and by competing with the bad germs for nutrients and space. Also, improvement of the barrier function. It keeps those tight junctions to prevent leaky gut syndrome, prevent the bad germs from going into the bloodstream. It also is responsible for immunomodulation, and that's just a fancy term for regulating the immune system or the immune response, and then neurotransmitter production, as we stated, with the neurotransmitters or certain substances that communicate with the brain. So why are probiotics important? They are important because of dysbiosis. Because dysbiosis, which is an imbalance in the gut flora or in the germs in the gut, the microorganisms in the gut, will cause a number of things that were discussed before. So you will have, with dysbiosis, your leaky gut syndrome, you will have your inflammatory response, the increase in your glucose levels, insulin resistance leading to diabetes, and a whole host of other awful things that we don't want. With a healthy microbiome, or with the balance in the gut as a result of our good germs or good bacteria, it will promote health in the body, general health in the body. All right, so probiotics, in terms of how the effects that they have on illnesses and diseases, probiotics is actually the link between the intestinal flora and the prevention and treatment of intestinal disease. So without probiotics, or without an abundance of good germs in the gut, you will find things happening like antibiotic-associated diarrhea, inflammatory bowel disease, Crohn's disease, colorectal cancer, and many other things happening in different systems in the body. And so that leads us to talk about the effects of probiotics on some of these things. So let's start with gastroenteritis. So some of the frequent causes of gastro are the rotavirus, E. coli, salmonella, and others. And studies have shown that lactobacillus species, which we'll talk about a little bit, streptococcus, bifidobacterium, those are some of the probiotics, or the good germs, that are essential for maintaining or getting rebalanced in the gut as they compete for nutrients and increases the immune response and aids in getting past the gastroenteritis a little faster. For lactose intolerance persons, low levels of the enzyme lactase in the mucosa of the small intestine for a lot of people. And actually, there are some probiotics that will provide microbial lactase activity, and that will improve the tolerance and digestibility of lactose, thus improving the lactose intolerance. Also in bacterial vaginosis, you will find that lactobacillus is in the normal flora of the vagina, and it produces lactic acid and protects the vagina from colonization of the bad germs. And so when that balance is disturbed and lactobacillus is either missing or decreased, you will have bacterial vaginosis. So it helps to replace orally the lactobacillus in order to get beyond or restore balance in the vagina. And there are a number of other systems that we'll go through quickly too, that probiotics have very good effects on, and that will probiotics will improve. So your mental health, as I said, releases neurotransmitters, and as a result of that, it will decrease your risk of anxiety and depression. It does have some cardiovascular effects. The short chain fatty acids are beneficial for inflammation. And one of the things that they do is that it can help to lower cholesterol. So modestly elevated cholesterol levels, it can help to lower that. In your digestive health, which we mentioned before, that it plays a huge role in just preventing some of the gut illnesses. So IBD, irritable bowel syndrome, colon cancer, antibiotic-associated diarrhea, among others. It also supports general immune function. It's very, well, it plays a role in your respiratory system as well. It lubricates your pulmonary tissues, as well as in asthmatics. studies have shown that it can improve your asthma symptoms as a result of its anti-inflammatory properties. Skin health, same thing, the anti-inflammatory properties, the vaginal health, same thing, and in infants, it can help to relieve colic as well as reduce the incidence and severity of your necrotizing enterocolitis. So we are going to move into the characteristics of probiotics. So they must be able to survive the passage through the digestive system. They must be able to attach to or stick to the gut and colonize. They must be viable, they must be live. They must be able to utilize the nutrients in a normal diet, and they must be non-pathogenic, meaning not causing disease, and they must be non-toxic to the body. They must be capable of exerting a beneficial effect on the host, and it must be stable. So you must have stability of the characteristics that you need during the processing, storage, and transportation of these probiotics. And of course, they must have anti-inflammatory, anti-mutagenic, meaning anti-cancer, anti-tumor, and immunostimulatory, meaning that regulating the immune system or communicating with the immune system. So the probiotic classification, there are many probiotics. However, the most studied ones are the Lactobacillus species and the Bifidobacterium species. There have been over 1,000 papers written on each of these probiotics. There are others, the Streptococcus, Enterococcus, and many others, as I said, but we have evidence to prove that the Lactobacillus and the Bifidobacterium actually confer health benefits and how they confer the health benefits. So in terms of consumption, probiotics, they're measured in CFUs or colony forming units, and that indicates the number of viable cells. So the study suggests that the minimum consumption is 10 million CFUs per day. And there are other studies that suggest that higher doses are more effective than lower doses. So your probiotics, as you'll see, comes in millions and billions of doses. Most probiotics don't permanently adhere in the intestine, but exert their effect as they metabolize and grow during the passage through the intestine. And so daily consumption of the good germs is the best way to maintain their effectiveness. So these are some of the probiotic foods or the functional foods. Yogurt, of course, your Greek yogurt in particular, your olives, your apple cider vinegar, as well as for infants, your breast milk. And you do have some probiotic cereals, and Okashi makes probiotic cereals, and those are on the market as well. And for your probiotic supplements, these particular supplements are recommended. They're good because they're trusted. They have a lot of studies backing them to say that they can, as I said, confer health benefits. The dosage is guaranteed, and they have strength up to the expiry date. So these particular probiotics, you can get them on Amazon. These ones are good. So some of the disadvantages of probiotics, we've gone through the advantages, so some of the disadvantages, which are very few, because there are very few side effects of probiotics. They're usually minor, and they consist of self-limiting GI symptoms, such as gas. There were a few cases involving persons who were actually in ICU, who were severely ill or immunocompromised, where the use of probiotics was linked to bacteremia and fungemia. or other infections that resulted in severe illness. But that particular study, the number was actually 6 individuals out of 22,000 that were noted in the study. Another disadvantage of probiotics is that more clinical trials need to be done to address safety of them. So wrapping up, one of the things in choosing a probiotic is that you want one, if you're going with a probiotic supplement, you want one that has a number of different strains. So as I said, the lactobacillus and the bifidobacterium, those are the ones that are mostly studied. So you want one definitely with those, that incorporates those. But you also want one that has a number of them, because different strains or different probiotics have different effects. So some probiotics will produce the short chain fatty acids, some may not. And so you want to have, as I said, good variety. So when you are looking for probiotics, just ensure to look at the nutrition or the supplement facts so that you ensure that you are getting a good variety of the strain of the good germ. So in conclusion, probiotics are beneficial live bacteria, which can have positive effects on your health. Probiotics have many health benefits on several organ systems, and they can be found in food and supplements. And the best probiotic supplements have a variety of strains. Thank you so much for listening. Thank you for your attention.